Good day, my dear friends. Today, our appointment with step 14 from MRI Learning lesson. I will talk today about the MRI ankle, tendons, and ligaments. So let's get started. This is diagram for the medial aspect of the tendons and ligaments of the ankle joints, and this one representing lateral aspect. In the medial aspect, the articulating surface superiorly is the medial malleus of the tibia, which articulates with the calcaneus, talus, and the navicular bone by these 10 ligaments, which is called deltoid ligament. However, in the lateral aspect, the articulating surface superiorly is the lateral malleus of the fibula, which articulates with the tibia through the interosseous ligament, and also articulates with the talus through the anterior and posterior talofibular ligament, and also articulates with the calcaneus with this ligament, which is called the calcaneofibular ligament. So the lateral collateral ligament and the medial collateral ligament representing the main ligaments of the ankle joints. This different MRI sequence, T2 and proton density fat separations sequence for the ankle joint in the sagittal plane, showing a lot of labeled here representing different anatomical structures. For example, one, this is a calcaneus, so this one is representing retrocalcaneal bursa between the calcaneus and the Achilles tendon. Two, this is the tibia and this is the talus, so this is the posterior process of the talus. Three, this sinus, which is called the sinus tarsi, articulating a surface between the talus superiorly and the calcaneus inferiorly by two ligaments here, cervical and interosseous ligament. So 3 is representing sinus tarsi. And the plantar fascia, this one which is most inferior aspect of the posterior surface of the calcaneus, and this is the plantar fascia representing the plantar fascia structure. However, this marker, yellow marker here in the T2 showing fats which is appeared bright signal in the T2, and in the proton density fat suppression sequence the fat is suppressed due to fat suppression, and this fat between the calcaneus soleus muscle and the posterior aspect of the talus and tibia, this representing a Kager fat bed. Kager's fat bed is very important structure in the ankle, as if it is disrupted or stranded fat representing hematoma or collections or tear in the surrounding organs or subtle fracture also. And now I will talk in this slide for the main stem of my presentation today about the tendons and the ligaments of the ankle joint. Tendons and the ligaments in the ankle joint, to understand and remember it, you should classify the ankle joint into 4 compartments: the medial compartment, lateral compartment, posterior compartment, and anterior compartment. The posterior compartment is including only one tendon, which is called the Achilles tendon. As we saw it before in the previous slides, and I have a lot of cases during this presentations. I will see it also. The medial compartment depend on the Tom, Dick, and Harry to remember the tendons in the medial compartment from the medial to lateral and from anterior to posterior, which is represented by the tibialis posterior tendon, flexor digitorum longus from D, Tom, Dick, and Harry, flexor hallucis longus. So tibialis posterior, flexor digitorum, flexor hallucis in the medial compartment from medial to lateral. In the opposite of this ligament arrangement is the anterior compartment. But first, I will talk about the ligaments in the medial compartment, which is called the deltoid ligament, as I'll describe it I described it in the previous slide. What about the anterior compartment? Anterior compartment showing arrangement of these tendons with reverse way. The tibialis posterior tendons here is the first, and also here is the tibialis anterior tendon from medial to lateral. And the second one is the extensor hallucis longus, which coming here as the third one. However, here it coming is the second one in arrangement. The third one is the extensor digitorum longus tendon, which appearing here as a flexor digitorum longus. So you can remember Tom, Dick, and Harry for medial compartment and reverse it for anterior compartment. And now lateral compartment showing two tendons only, the peroneus longus tendon and the peroneus brevis tendon. Peroneus longus is lateral and the peroneus brevis is medial. However, the lateral compartment composed of a lot of ligaments, and the very important ligament here is the anterior talofibular ligament. There are also posterior talofibular ligament and calcaneofibular ligament, as I presented it in the previous slide also, or diagram. And also there are tibiofibular syndesmosis between the tibia and the fibula, and this is composed from anterior and posterior tibiofibular as well as transverse tibiofibular ligament. There are also interosseous ligament, and this is all are named as under the tibiofibular syndesmosis. And this slides to remember all the tendons and the ligaments of the ankle joint. And now, this is MRI in axial image, proton density fat separation sequence, showing all the tendons I described it before. First of all, you should determine where is the lateral and where is the medial. The fibula is representing the lateral aspect of the film, and the tibia is representing the medial aspect of the film. And this one is the anterior, and this one is the posterior. So, the only tendons in the posterior compartment of the ankle is the Achilles tendon. So, this one, black one, is representing the Achilles tendon. And now, go to the medial compartment, the side of the tibia, and there are three tendons here, black tendons, appearing black. They are arranged according to Tom, Dick, and Harry: tibialis posterior tendon, flexor digitorum tendons, and flexor hallucis longus tendon. This compartment representing flexor tendons. However, the anterior compartment representing the extensor tendon, and arranged by the same way with the reverse of the hallucis and digitorum. So the first one from medial to lateral is the tibialis anterior tendon, and second one here reverse these two, so extensor hallucis longus and extensor digitorum longus at the most lateral aspect of the anterior compartment tendons or extensor tendons. Now remaining the lateral compartment, which composed from two tendons, the peroneus longus tendons, which are lateral, which appeared lateral, and the peroneus brevis, which appeared medial. There are also ligaments, but the ligaments is not appeared clearly through this diagram. Okay, and this is sagittal T2 weighted MRI imaging showing the articulations between the talus and the calcaneus anteriorly by two ligaments, as we see here in this diagram, the cervical ligament and the interosseous talocalcaneal ligament. The cervical ligaments articulates anteriorly, and the interosseous talocalcaneal ligaments articulate posteriorly. So this ring representing sinus tarsi, and to remember the two ligaments, the cervical ligaments articulates with the neck of the talus, cervical neck. To remember, the cervical is the anterior one. And now, who want to enjoy with the radiology through cases challenge? We can get started now. First case, this is axial image of the ankle, proton density fat separation, as we can discriminate the bone from the muscle. And this arrow representing one anatomical structure. Which one? Actually, this is the fibula and this is the talus. So this is the anterior aspect and this is the posterior aspect. So this one representing the anterior talofibular ligament. Anterior talofibular ligament. This is one from the most important ligament which injured in the ankle ligament, ankle joint. Next, this is coronal T2 star image, and this arrow representing which structure? As you see here, this is the tibia and this is the tibial plafond. So this is one is the medial malleolus, and tibia articulating with the talus. So this one is the talus, and this ligament is articulating between the medial malleolus and talus or calcaneus. So this one is the deltoid ligament. Deltoid ligament have three compartments articulating between the medial malleolus and talus, calcaneus, and navicular bone. So this one is the deltoid ligament, which representing medial collateral ligament of the ankle. Arrow, which structure representing? This is axial proton density fat separation, and this is the posterior compartment. The only tendon in the posterior compartment is the Achilles tendon. Next, this arrow representing which structure? This sagittal stare image, as the bone and muscles are suppressed, also fat. So this is stare image in sagittal view, and this region is the region of sinus tarsi, and this arrow representing one ligament, which is connecting the neck of the talus with the calcaneus, anterior aspect of the calcaneus. So neck, cervical ligament. So this one is the cervical ligament. Next, as you see here, this part is the fibula, and this arrow representing one tendon at the lateral aspect of the or lateral compartment of the ankle region. Like this diagram, there are two tendons at the lateral compartment of the ankle related to the fibula and passing posterior to the lateral malleolus. These is two tendons are the peroneus longus and the peroneus brevis. Peroneus longus is lateral and the peroneus brevis is medial. So this arrow is representing the peroneus brevis tendon. And you can also remember these two tendons and differentiate it from each other by the longus lateral. Although the peroneus longus is lateral. This one is the peroneus longus, so it is lateral. Peroneus longus tendon lateral. However, peroneus brevis is medial tendons at the lateral compartment of the ankle joint. Next case, this arrow representing which ligament? Actually, this is the tibia, and this is the talus, and this is the calcaneus. The regions between the talus and the calcaneus are articulating by the two ligaments, one anterior and one posterior. So this is the posterior one, which is called interosseous talocalcaneal ligament in the sinus tarsi region. Case 7. This arrow representing which tendon? Actually, this is axial T1 weighted image, and this is the tibia, this is the fibula, so this is the medial aspect, and this is the lateral aspect. In the lateral, there are two tendons, one lateral, which is peroneus longus, and one medial, which is peroneus brevis tendon. and one posterior, which is Achilles tendon. In the medial compartment, tom, dick, and harry, tibialis posterior, dick digitorum, flexor digitorum longus, and flexor hallucis longus. However, in the anterior compartment, the tibialis anterior is okay. However, the other two tendons are reversed for the tom, dick, and harry. So if this is dick, so this is the hallucis. So this is the extensor compartment, extensor tendons, extensor hallucis longus tendon, extensor hallucis longus tendon. And this one is the extensor hallucis, extensor digitorum longus tendon. This tendon again, this is the medial compartment tendons. There are three tendons, tom, dick, and harry. So this is the flexor group, flexor hallucis, harry, hallucis longus tendon. Case 9. This one is the medial malleolus, and this is the talus, and this is the calcaneus. What is this arrow representing anatomical structure? This is the talus and this is the calcaneus. The most medial, this is the medial malleolus, so this is the most medial part from the calcaneus articulating with the talus with these structures, which is called sustentaculum tali. In the sustentaculum tali, there are articulations between it and the medial malleolus through this ligament, which is called the deltoid ligament, medial compartment of the neck, and it also representing anatomical structures as the inferior aspect of it have a groove passing through it is the flexor hallucis longus tendon. So this structure is the sustentaculum tali. Case 10 and last case, which is arrow representing sagittal proton density fat separations, as you can discriminate muscle from the bone. And this one, the most posterior tendon, which is called the Achilles tendon, retrocalcaneal bursa and part from the calcaneus. This is the talus and this is the tibia, and this is the part from calcaneus. The articulating tendons between the calcaneus and talus is called the cervical ligament. This is the Achilles tendon as we mentioned now, and this is the retrocalcaneal bursa. And now let me summarize my presentation. This is the main stem of my presentation today. The four compartments of the ankle joints. Medial compartment represented by tom, dick, and harry, tibialis posterior, flexor digitorum longus, and flexor hallucis longus as tendons, and the only ligaments is the deltoid ligament. Lateral compartment represented by two tendons, which is peroneus longus, peroneus brevis, and ligaments, anterior talofibular and posterior talofibular ligament, calcaneofibular ligaments, and tibiofibular syndesmosis. And the anterior compartment is reversed to tom, dick, and harry. So tibialis anterior from medial to lateral, extensor hallucis longus and extensor digitorum longus, and the posterior compartment represented by the Achilles tendon. I hope this lesson has helped to make a few things clearer for you. Thank you much for watching and listening, and you can follow me in more than 60 presentations in my Google search Easy and Different Radiology is the name of my channels. And you can follow me also in my YouTube channels every Wednesday for MRI Learning, every Sunday for Rapid Review, and Friday for Mnemonic Word. Thank you and have a nice day.